Ladies and gentlemen, we are going to move on to our next speaker, who is a compassionate guide, or our next speaker is a compassionate guide through the intricate maze of our emotions. With a profound understanding of the human psyche and a wealth of experience in the field of psychology, Barry Viljoen is a shining light in helping individuals navigate the emotional burden that comes with life's challenges. Barry's professional journey has been diverse and impactful. He is a clinical psychologist with extensive experience in both the private and state sectors, and his expertise spans primary, secondary, and tertiary care settings. He has made meaningful contributions in contexts as varied as correctional and rehabilitative facilities. What sets Barry apart from not just his extensive resume, but his passion for knowledge sharing. He has been a distinguished presenter at numerous conferences, both on the international and local stage, where he's addressed a wide array of topics. His areas of special interest encompass behavioral problems, trauma, family and parenting challenges, substance use and abuse difficulties, chronic pain management, life stage adjustment issues, and neuropsychology in rehabilitative and forensic contexts. Today, we are fortunate to have Barry Viljoen share his insights on the topic that is close to our hearts, the emotional burden of living with a chronic disease. His expertise promises to shed light on how we can navigate the complex emotions that come with such challenges. Axbar Warriors, please join me in giving a warm virtual welcome to Barry Viljoen.
Right, so thank you so much for a fantastic introduction. I hope I can live up to the to the hype. So I think let's start off with just speaking a little bit about dealing with the emotional aspects of a chronic disease. And I think if I can share my slides, I'll do that with you now. Just one second. Let's see if that works. So obviously we're going to be speaking a little bit about the emotional aspects of dealing with a chronic disease and looking historically, the physical health is obviously closely related to our emotional and mental health. And a lot of the time, I think historically, if we look at it, mental health was seen as different to physical health. And with illnesses and chronic illnesses, often it was just seen as this is something that needs to be treated medically, and there wasn't much thought about our mental health. And we know that mental health is going to intersect with all aspects of our lives. And obviously, if we're not feeling good, if we're feeling sore, that's going to affect that as well. So there's obviously been a strong correlation noted amongst those generally who are middle-aged and older that the health has a much bigger effect on the mental health, physical health now. However, obviously this is disproportional. As we get older, generally our health tends to dissipate or decrease. However, obviously with chronic illnesses, this can be very different and it can affect us at any times in our lives. So obviously, there was the talk about how individuals differ with both their adjustment to both acute and chronic illnesses. And we know, and this has been the question in research, is why do some people respond better? Why do some people have less impact than others? And one of the arguments that was spoken about at the time was just with regards to our coping efforts and our coping strategies. Obviously, we've come a long way since then, but just giving you a little bit of a historical background, that again, these would affect very much our levels of emotional well-being. And now how we understand and encapsulate emotional well-being has also changed quite significantly, and that should also be noted. So when they spoke about coping strategies historically, if we look at the older literature, which started to finally see the value of mental health in physical illness, they looked at things like denial, they looked at selective ignoring, information seeking, taking refuge in activity avoidance, learning of specific illness-related procedures, fantasy, and blaming others. You can hear a lot of these are quite negative or not necessarily constructive coping mechanisms or coping strategies. And that's developed. And I mean, now we have a whole field called health psychology in which there's a far greater understanding as to, this interlink. And that's what I'm going to touch on now. But obviously what also came with this was identity income challenges. And I think specifically with a chronic disease such as this, we know it affects both your identity as well as your income. And identity can be on many levels. So I think has been shared by many people who use the word warriors of this disorder, have highlighted the fact that there were things that they could do and things that they defined themselves as, which they had to change. And necessarily that doesn't mean that you can't do that, but just how we see our identity has been affected. And now that can also be quite a challenge, and that can take a bit of time to overcome or to make sense of where am I now, who am I now, or some patients of mine have spoken about being version 2.0. So, that they can still do a lot of things and they can do different things, but they themselves are a newer and improved version. And improved, obviously, is just where they've taken aspects of being more aware of themselves, maybe being more self-kind, and just being more aware of their bodies and the limitations or what their body tells them. And so then, obviously, income challenges, with this chronic illness specifically, we know it affects generally, or it's generally diagnosed, hopefully between 20 and 30, where people are developing their career. They've generally finished training, and they're really trying to build into that career. So it can definitely affect your ability to work, even your desire to work, maybe at times when we're not feeling great, motivation, the like. So then we have something which you call the biopsychosocial model, which has become a lot more popular. And now if you look at here, the biopsychosocial model is just a nice way of encapsulating how our biology, our psychological health, our social health, all of these aspects intersect. And we're somewhere in the middle where all of these bits touch on. And at times, different elements of ourselves are going to affect who we are and where we are more than others. So you can see that there is no health without mental health, but in the same light, physical health is going to affect mental health. It's going to affect our social aspects as well. And I think that's what we're going to talk about, of our relationships as well with families, with peers, and how they can all affect us. So the other thing that's come into the field, and I think it's a very valuable and important thing, are things like quality of life and well-being. So now this is again different because, and we'll touch on it a bit more, historically the assumption is if there isn't a clear mental illness, that we're well and we're happy and we're fulfilled. However, we know that's not the case. And now, which we'll speak about a little bit later, they speak about things like flourishing and, really finding meaning and purpose, which is so important to all of us. So here, quality of life is the concept which aims to capture the well-being, whether of a population or individual, regarding both the positive and negative elements with the entirety of their existence at a specific point in time. So I think most of us here are South Africans, and we know when load shedding, for example, as a silly example, had got really quite extreme, a lot of our well-being and our mental health was being affected because we couldn't be productive. And I think there was a general sense of frustration in the population, as well as on an individual and group level. So you can already see how our environment affects so much of our well-being. Whereas if we think about, say, like a really good time in South Africa, we think about 2010, and there was, or even when you had Ramaphoria, there was this energy that South Africa had. So you can already hear how that affects our well-being, even if it's only for a short period of time, right? And then again, like I was saying earlier, well-being is not just the absence of illness. It's a complex combination of a person's physical, mental, and emotional, as well as social health factors. So if I'm feeling physically well, if my mental health is well, if my emotional needs are being met, as well as my social health. So do I have meaningful relationships? Do I get to spend time with people that are important to me? Do I get to do fun things? Do I get to have a good work-life balance? All of those are so important for our well-being. So if we think at times in our lives, I'm sure it's very hard to balance all of these things, but they're all equally important at different, equally, but they're going to impact on each other. So, we can change at different times, maybe sometimes, let's say for exam times, for anyone who's got a child who's writing matric right now is the time where social health kind of has to take a little bit of a back burner, for studying and for getting really good marks. So we know that well-being is strongly linked to happiness and life satisfaction, and those are very important things, because we know that life satisfaction, looking back, there's nothing harder than looking back at life and looking at wasted opportunities or not having had meaning in that time. Because I think that's quite, a lot of the time as we get older, we look back at, wow, those were amazing memories. And it leaves us with a sense of satisfaction, of accomplishment of different stages of our life. Obviously, at times we will have regret, and we can learn from that, hopefully. but just highlighting that that's quite important. Also, that just our general happiness. I think sometimes as a society we think, oh well, we can, leave happiness on the back burner for a little bit, so that we can achieve things. And we know that that kind of hustle culture, if you will, has had some negative ramifications for people in terms of their happiness and actual life satisfaction. Because again, life is so much more than maybe material things or making money. But it's, obviously those are important, but then our interpersonal relationships are so important for our mental health, well-being, and happiness, and meaning in that it comes in as well. So well-being can be considered how we describe and as how you feel about yourself and about your life. So you see, again, there's that interplay. It's not quite as simple as just one aspect. And again, we might have periods in our life, when we get maybe a diagnosis where we don't feel too happy about ourselves or about our lives. But it's again, the difference of that can be a normal adjustment period as opposed to something that is a chronic disorder or a disorder or diagnosable. So mental health as well, when we speak about, because I use the word quite frequently, again, there's been big shifts with that. So what the World Health Organization speaks about is that mental health is a state of well-being, and it enables people to cope with the stresses of daily life. So of course, stresses are normal aspects within reason. Also, our mental health allows us to realize our abilities and to learn and work well. So we see how it's all coming in from that biopsychosocial model, as well as our ability to contribute to our community, which is seen as an integral part of just a component of both our health and our well-being. That underpins both our individual and our collective abilities to make decisions, to build relationships, and to shape the world we live in. So we hear there's a certain level of mastery that comes along. So mental health is a basic human right, and I think that's an important thing to keep in mind, that all of our mental health is a basic human right, and that we shouldn't neglect that. And it's crucial for both our personal, community, and socioeconomic development. So you hear how all three of those interplay there on the different levels and the different spheres of ourselves that we identify and hold with. So mental health, and as I've said before, is more than just an absence of mental disorders. So just because I'm not depressed, just because I don't have another clear diagnosis, doesn't mean that my mental health is fantastic, right? It exists on a complex continuum, which is experienced differently from one person to the next, with varying degrees of difficulty and distress, and potentially different social and clinical outcomes. And that's an important one to keep in mind, because I think that too often, especially within this context in South Africa, we focus too much on a curative element, and we focus on a historical or traditional medical model of, well, if there's nothing, or reactive, shall I say, if there's nothing wrong, well, there's nothing wrong, which we know that it doesn't have to be clearly tangible aspects, right? There's a lot more, it's a lot more complex and nuanced. So mental health conditions include mental disorders and psychological disabilities, as well as other mental states associated with significant stress, impairment in functioning, or risk or self-harm. Now, these are obviously extreme versions, but you can hear that, again, it just highlights the point that, our mental health conditions don't have to be clearly diagnosable aspects, right? There can be a whole lot of other challenges that we can go through at times. Right. And people obviously with mental health conditions are more likely to experience lower levels of mental well-being, right? But that's not always the case necessarily. So just because I have been diagnosed with depression, or I've been diagnosed with schizophrenia or bipolar, doesn't mean that my mental health or my mental well-being is always going to be a problem. Because again, it depends. I can be in remission and I can find meaning and I can get a lot more purpose in my life. In the same light, just because I haven't been diagnosed with those things doesn't mean that my well-being will necessarily be better. Obviously, we're talking, I'm talking, it has to be managed, any kind of disorder like that. I'm not saying they don't exist. Right, so when we talk about disability, and this is an important one as well for me, and I think, some might say this is a bit of an advocacy role that I feel. I think we need to keep in mind that disability is more complex than just visual disability. The disabilities that we can see, and that it also depends very much on how we can engage in our environments and the meaning and the purpose which we can derive therefrom. Because again, just because someone doesn't look like they have a disability doesn't mean that they don't. And again, there's a social aspect that comes in there. So disability is part of being a human, right? It's not maybe always the easiest part. And almost everyone will be temporarily or permanently experience disability at some point in their life. That's what the World Health Organization is saying. And they're estimating that 1.3 billion people, that's about 16% of the global population, currently experience significant disability. The number is increasing due to an aging population, as well as an increase in the prevalence of non-curable diseases. So I think that's an important thing to keep in mind as well, that as we build a more inclusive society, we need to keep in mind that that disability is going to be a prevalent aspect, and that we need to also look at how we can minimize people's disability. Now, this is what I'm going to touch on in terms of when I say, how do we minimize it? Right. So a person's environment has a huge effect on the experience and the extent of the disability. Right. So inaccessible environments create barriers that often hinder the full and effective participation of persons with disability in a society on an equal basis with others. Progress on improving social participation can be made by addressing these barriers and facilitating persons with disability in their day-to-day lives. So again, let's think about something very simple, right? So accessibility. If you look at just having something as simple as a wheelchair ramp, that can hugely impact on someone's level of disability because they have access to a building, they have access to facilities, right? So as soon as we have places that are more disabled friendly, right, it means that the impact of the disability is less and people aren't as disabled or as disenfranchised. And that's an important aspect that we need to keep in mind. And again, there's a lot of politics that come into that because when we think about physical disability, like I've given an example myself falling into the trap, that just because someone doesn't have a physical disability or visible one, doesn't mean that they aren't going to have challenges, say, with communication disorders or even just aspect, and that can vary from things like aphasia to even something like a stutter in extreme cases. So I think it's important that we keep that in mind and we look at how we can build not only a more tolerant and inclusive society, but just also a more aware society. So this is some work that I find very interesting by Keyes, and I think it's an important one to look at. He speaks about the mental health continuum. So if we look here, it's a continuum. So historically, we wouldn't have seen it that way. We would have seen it very much as a dichotomy of you're well or you're unwell. And now here we can look at this continuum. So we've got here where people with mental illness, so that's obviously an untreated mental illness, where there's positive symptoms. Is there kind of on the one side of it, and we move to then maybe a space of languishing. That doesn't necessarily mean that you don't have a mental illness. It just means that you're not engaging with a meaningful life or having your purpose met, and you're not necessarily doing as well as you could. We then move into kind of areas where we talk about moderately mentally healthy, whether you're not flourishing, you're not languishing, you're kind of somewhere in the middle, right? Historically, that would have been well, but we can see that there's more to it. And then kind of on the higher levels of the continuum, we talk about complete mental health and flourishing. So he's talking about high levels of well-being, high functioning, engaging, meaning, having purpose, and the like. And that's very much what flourishing means. And flourishing is within your context. And this is something I explain to students and interns that I train, is that we have to be aware of the context. What is flourishing for me won't necessarily be flourishing for somebody else. So we need to look at the contextual factors as to what would give them meaning, what would give them purpose, what would give them a meaningful life in which they are flourishing and achieving and self-actualizing. And I think that's an important one to keep in mind. That again, one shouldn't try and assume that a certain life is for everyone, but it's within their limitations. And I think that's also an important one as well to just keep in mind. But I think the mental health continuum is a great way of just seeing mental health. So now I'm going to speak a little bit more about diagnostic elements. So I think whenever anyone gets a chronic, is diagnosed with a chronic illness, the question is, as a mental health professional, is what do we say for medical aids? What do we say for treatment and the like? And now far too many people speak colloquially about maybe feeling depressed or hopeless or not sure what to do. But again, keep in mind, this isn't depression because this is a response to a very specific ailment. And this is where the adjustment disorder and the DSM is so important. I'm going to speak about it because it's something that I think is important, that we shouldn't diagnose with depression. Depression can't be diagnosed if it's as a result of a loss, a result of a life change, which we know a lot of those aspects occur with chronic illnesses. So I'm going to touch on it very briefly. I don't think it's the most important thing, but just to keep in mind, and especially if you are needing the services of a mental health care practitioner, more frequently than not, you probably would be diagnosed with an adjustment disorder, because it's again about adjusting to aspects of your life. And it's often what's termed a maladaptive response to a psychosocial stressor, right? And it's classified as a mental disorder. Now, why I say this is so important is because this isn't going to affect aspects of life insurance and other policies which, diagnoses like a depression can. And I think that's also why it's important to be empowered, that you know what your diagnosis is and what the ramifications are later. So if, and I'm going to say this, I don't mean to make light of anything, but if after a diagnosis I have depressive features, and it's part of my process and my journey, and an adjustment disorder can stay for about a year, is currently where DSM-5-TR stands, without it having to be converted into anything else. That, it's in response to coming to terms with a very difficult illness. So let's say I get diagnosed with cancer. Of course, well, my thought is I'm probably most likely going to be in shock. I'm going to have some depressive features, and the reality is it's going to be very hard. But again, I don't think I should be diagnosed with depression at that point, because for me that's an adjustment disorder, because it's in response to a psychosocial stressor, that of being diagnosed with cancer. And we know that maybe in a year's time, depending on treatment and the like, I might be in a very different space of my mental health, or I might even go into remission, which is the hope. And then the question is, well, where to from here? I've got this history of being diagnosed with depression, which is going to affect a whole lot of aspects of my life. And this is where an adjustment disorder, like I say, isn't going to, that label, that stigma doesn't carry on, because it is, and I would want to use the word acute, but I mean, a year is not really acute, right? But a short-term response, maladaptive response to a psychosocial stress. So normally it usually involves otherwise normal emotional and behavioral reactions that manifest more intensely than usual. Now, see, this is a tricky one, right? Because again, you have to consider the contextual and cultural factors. Being diagnosed with a life-changing disease or a chronic disease, I think, we can definitely be on the higher ends of emotional response when we get that news and when we're trying to adjust and make sense of it. So again, it causes marked distress, preoccupation with the stressor, and the consequences, and often functional impairment. And I think that's an important one, because we heard throughout today about it's also certain adjustments to your life to make your life and to take your life back as your own life. And I think that's the part where I'm talking about. And I hope that can make sense. That I'm just saying I think is an important one just to keep in mind. And maybe in that also to be a bit kinder to ourselves and not to overdiagnose ourselves, and just put ourselves in a potentially tricky situation. Here I just had a couple of the criteria. I don't think that's that important. I think we've kind of touched on it a little bit. Yeah, so I think we can skip across there. Just to keep in mind, there's subtypes to adjustment disorders, and this is developed as time has gone on. So an adjustment disorder with depressed mood, again, why I'm saying why is it not depression? Because it's with depressed mood to this result. With anxiety, right? I think that's also a very common experience when we get the diagnosis of a chronic illness. What does this mean for my life? What can I do? What can't I do? Where am I going? And the like. Then you can also get the subtype where it's mixed of depressed mood and anxiety, which I think is probably the most common, because I don't think they're very clearly, mutually exclusive. With disturbance of conduct, that's where you see changes of behavior. And that's important, that we shouldn't see that as, personality changes, but we're just behaving differently or responding differently to situations. They can be sometimes when we're a bit more irritable, maybe a bit more prickly, as some people have used the term, or just not feeling as strong and resilient as before. And then unspecified, and this is a helpful one sometimes, because this is when we're seeing a little bit of everything. And I think that's also important, that a lot of the time that's what's going to happen. It's going to be a little bit of everything. So thinking about today and what we're talking about today specifically, there are a couple of comorbidities that are very importantly highlighted in the literature with regards to our mental health. So we've seen an increased risk of both depression and anxiety with this diagnosis, right? We've also seen sleep disturbances, and we've also seen an association between sleep disturbances and associated mental health conditions. Now, regardless of whether you have a chronic disease or not, if you sleep poorly, the next day you're not going to feel your best. If we really start to unpack that, we might feel a little bit low in our mood. We might feel a little bit anxious. We might feel a little more easily overwhelmed, because depression is more complicated than just feeling sad. There's a lot of aspects to it. Yes, that's a core element, but we can be more irritable, we can be less resilient, we can be more easily overwhelmed and the like. So that's important reason to keep in mind. And that's where we're going to talk about a couple of skills, and hopefully this will meet some of the needs today. I just think it's important to encapsulate these aspects. Any kind of psychotherapy from a psychologist's perspective is not going to be curative, but the idea is to make it that life can be more livable, and skills to manage the challenges and overcome the challenges of life. In that, sometimes psychiatry is required as well, and I think that's an important one to also know where pharmacological assistance is required, and where it's no longer just looking at psychology. So I think sleep hygiene is one of the biggest things. So we know the big issue is that if we're sore, we don't sleep well. With this, if we're sore as well, it's not only about getting to sleep, but it's about maintaining sleep, right? So sleep hygiene is a helpful tool to try to bring in. So that speaks about why we have it, is because there's been a steady decline in general in the population internationally with the time spent asleep. There's increased attention on an interest in poor sleeping habits, right? So how can we get people to sleep better? And of course, sleep hygiene is that. It's described as the practice of behaviors which facilitate sleep and avoid behaviors which interfere with our sleep, right? Easy enough. Sure. Maybe not. So here's some little helpful tips. I'm happy to share these. This is from Harvard, if I'm not mistaken. Their kind of little tools kit, like quick things. Obviously, stopping the use of electronic use pre-sleep for about 30 minutes. So not playing on our phones, not looking on, watching TV and the like. So they've also said, the other aspect is we should only be using bed for sleep, for sex, and for sickness. We shouldn't be sitting there and eating and doing other kind of things like watching TV on the bed, right? Or just lying on bed and reading. This is especially if we're having trouble sleeping. Also, if you're having trouble sleeping in the evening, it's important not to have naps. So we try to remove those. So that's also important, because sometimes, and I speak for myself, if I had a long night, if I'm really tired, it's very tempting just to have a quick nap, and then I might not sleep as well, or I might stay up later, because again, we want to try to get ourselves into a rhythm. And that's the important thing of routine, is what they're talking about there. So that's, again, keeping fixed bedtimes, of time to stay awake and time to stay asleep. Try to avoid caffeine and alcohol 4 to 6 hours before bed. Now, that's the whole problem, right? When do people drink more? We go out in the evening and we drink, which can be fun. We can spend time with people we like. But in mind, also, do release pre-sleep. So, we shouldn't be running too much and going wild just before, like the Springboks against France over the last weekend. That definitely affected my quality of sleep, because I was quite tense. Not sure anyone else was after that. So also, we need to improve our sleeping environments, and that's as much as we can. Try to, move lights, charges, and things away from us that we're not going to be affected by it. Exercise, right? Again, that can be very helpful, but we shouldn't try to exercise about 2 hours before we go to bed, is what they say. Get up and try again. So if you can't sleep for over 20 minutes, so if you're just lying there rolling around bed, get up, do something for a little bit, and then get back to it. So then also learning about sleep. Because again, if we obsess over our sleep, what's the first thing we'll do? We're not going to sleep well. If I'm worried that I'm not sleeping, I'm not going to sleep well. In extreme cases, or cases where this is not working, I think we need to keep in mind that we might need to seek medical advice as well. Then, what you can also do, which can help, is to make a worry list, and to stop and to stop doing boring activities pre-sleep, or do boring activities, not stop, do boring activities. If you need help sleeping, I can give you more than enough reading that'll definitely put you to sleep. Stuff that I struggle with. Right, so just another one that's just, I think it's a nice, easy one to look at. It's a bit more nice visual. So just to keep in mind what to do and what not to do, because again, this doesn't stop our problems, but it helps. It helps to make us more resilient if we sleep well and if we look after our sleep. So something else that can be helpful is mindfulness. Now, I know this has become very popular. So mindfulness is all about being in the moment. It's about hearing, experiencing, the like. And you can do it very simply. You don't have to do it incredibly hard. So or to an incredibly intense level. For example, how do we ground ourselves in the moment? Something very simple. If you have, today is a nice and warm day where I am, I hope it is where you guys are as well. If you have a glass of water, to close your eyes, pick up the glass, very much before you drink the water or cold drink or whatever you have, almost smell it, feel the cold on your hands, to gently put it in your mouth, to move it around your mouth, to experience the sensations, to slowly drink it, to feel it going down your throat, and just to really focus on that aspect. And that moment we can just be centered, we can be more in touch with our bodies, and also just be able to be aware of where we're at, because often there's just so many things happening. We all live very busy lives, that to really stop ourselves in the moment is a good start. So mindfulness can help a lot. It's also very helpful in pain management, which we can at another point maybe give some workshops on. So that's just a very simple one. Another one that's a very easy one for getting into mindfulness, if you have a pen, and to try to feel the pen and just describe the pen using as much of your senses as possible, and really focusing on every little aspect of it and just how you feel to it. What is your response to those tactile elements? And saying that, mindfulness does unfortunately also mean that sometimes in a hard moment we sit in the hard adversity, but we experience it and we allow ourselves to go through those motions and then to actually work through it as opposed to avoiding it. So maybe that mindfulness is also very helpful, like we're saying. So let's think about CBT. CBT can also be very important for chronic pain management. So that's cognitive behavior therapy. It's become very popular. So that's a combination of cognitive and behavioral therapy, taking them together. So what this basically means, if you look at the first circle, our thoughts affect our behaviors, affect our emotions, and this can go anywhere. If my behavior is that of someone who's in pain, because I am, my emotions are going to be negatively affected as well as my thoughts, and we can all catch ourselves in those loops. So sometimes it's much easier to change our behavior than to change our thoughts and emotions, and we work with that. We work on trying to reduce those negative loops, right? And it's not going to stop things, but it's going to try hopefully make life a bit more manageable. And within chronic pain, here, now taking it to the CBT route, we think about there's distress, or there's chronic pain, which takes us to decreased activity, right? So that's my behavior. I stop doing things I love. I start having negative emotions because I now feel useless. I feel frustrated. I then try to avoid these feelings and these thoughts, which eventually takes me to distress, and we see how that loop goes. So again, if we can come at any point to try to break that aspect of, even if it's my behavior, so I've got pain, so I want to not and stop doing what I was doing. Okay, so instead of stop doing it, what can I do that still brings me joy within a manageable level? And we can really hear how then that will affect the negative emotions becoming less, the avoidance will become less, and the distress. Often a lot easier said than done, but that's kind of the cycle that could be helpful. So something else I find very helpful, especially if I'm feeling emotionally overwhelmed, are some DBT skills. So DBT is what they call a third wave behavior therapy. So that's where it looks at our behavior, but in conjunction with larger aspects of life. It's useful for a ton of things. I mean, it was originally developed just for emotional regulation and management with borderline personality disorder. However, it's come into its own with a variety of things. So there's elements of mindfulness to it, but also there's it's very skills based, and it's all about developing and building a meaningful life for yourself. So I just want to talk about tip skills quickly. And this is something when we go into crisis, because the reality is we're all going to go into crisis. And on a bad day, when we're feeling sore, we're feeling bad, we go down on a bit of a roller coaster where we take ourselves to some very dark places and we just become very overwhelmed. And this is what I like about some of the DBT skills. Specifically, this is one that stands out for me. It's very much about, in case of emergency, break the glass. And I don't mean literally break the glass, but it's basic things of just managing ourselves. So T is for tip the temperature on your face with some cold water. So a little bit of cold water just to help cool us down, just to change that aspect. Holding our breath, putting your face in a bowl of cold water, maybe holding a bit of an ice pack or an ice cube to maybe an ice socket to your cheek just for 30 seconds, just to kind of cool ourselves down, just to really take away that kind of sense of just that, runaway train. Sometimes they also speak then about intense exercise. So that's again, and when I say intense, with what you can do, it's not to go and cause more pain, more discomfort for yourself, but maybe something that just takes our mind off. And they can even be maybe going for a stroll, but just something like that. Then again, about much easier to control as well is to pace our breathing. So if I'm anxious, I breathe much more shallowly and much faster. So what I want to do is I want to focus on breathing very deeply and holding it and letting it out. And again, what's going to happen with that is I'm going to start, my heart rate is going to decrease. I'm going to start feeling a bit less overwhelmed. I'm going to start feeling in control. And that's what these skills are for. And then you could also look at paired muscle relaxation, which is ways of like, tensing muscles, releasing muscles. You can look at like the Jacobson's relaxation techniques, which we are not going to have time to go through that, but that's something you can look up. It's a very nice, easy way of just tensing muscles and releasing muscles and making us feel a lot more in control. Well, a lot more relaxed, more than in control, but the two kind of go hand in hand interchangeably. Something else I want to touch on a little bit, which isn't so popular in South Africa, is ACT, which is acceptance and commitment therapy. And now this has become internationally very popular because as opposed to CBT, where we're trying to avoid or trying to minimize the experience, with chronic illness, we know it's not going to change, unfortunately. It's there with us. So this is about changing with psychological flexibility, if you look in the circle, our psychological flexibility. And we're trying to change our relationship with our illness. Right. So as opposed to it being an adversarial one, rather one where we can see, okay, this has changed aspects of my life, but this is a journey we're walking together. A fantastic book which I feel illustrates this is a book. It's more about aphasia though, but it's called The Goddess Aphasia, where a man loses his ability initially loses his ability completely to communicate, and later just suffers with aphasia, which is a communication disorder. But again, it talks about the journey of initially being very frustrated and seeing aphasia as something that is destroying his life, as opposed to something that is changing his life, but it's a journey they walk together. And again, it's about this diffusion. So it's our ability to recognize our thoughts as just thoughts rather than fussing, with the content as an absolute reality, our acceptance, our willingness to not avoid the painful experience, but also keep in mind this is part of living and part of experience, unfortunately. Contact with the present moment, so being aware, that's where mindfulness can come in there as well. The values, having a clear understanding as to what it is that we want our life to be about, and the directions and the goals, and then commitment to actions, setting achievable goals that further our values, and commitment to act in ways which can help us to reach them. So I think, and also self-context, so it's being aware of just with self as context, being aware of where we're at. So what are my limitations and how do I work in that? And I think then it's also important to speak about our social support networks, because we know when we are in a low space or a depressive state, we do the exact opposite of what we should. We know we need to reach out for help, but the problem is we don't. We self-isolate, and that's hugely important because we need to reach out to and build those social networks, either with our partners, our family, co-workers, neighbors, community, friends. And I think that's important because it helps us with we can get help, reassurance, emotional closeness. We can have certain aspects of our meaning coming in as well, can be addressed. Shared interests, which can be fun. I mean, stuff that you guys can do together, that's fun. Maybe sometimes guidance and support. And I think that's an important aspect. That it's not all just about the heavy stuff. Sometimes it's also about the fun stuff. But we need to actively, when we catch ourselves self-isolating ourselves, seeing, wait, maybe I need to actually be with people. Maybe I need to do something fun. Maybe I need to go and watch a movie with a friend. Maybe I need to go and have coffee with someone. If we're physically not in the space to do something, maybe active. And just also being open and aware and being able to communicate that, I'd love to go hiking today, but I'm really not feeling up to it. I would like to see you. Could I maybe meet you for a coffee afterwards? And get our meaning and our connections met in that way. So I think it's important just to keep it that loss is a big aspect of these disorders, or these diseases, being diagnosed with them. And we need to keep in mind that loss, unfortunately, is a part of life, but it's complicated because it's, it can be physical loss, relational loss, symbolic loss. And what I want to speak about a little bit is symbolic loss more so. I know we're almost out of time, but symbolic loss is the important one, which isn't spoken about as much. And that's not about a clear and definable aspect of what have I lost. It's rather about the idealized future of what I wanted to achieve, what my life would have looked like. And that's a huge thing that we also need to keep in mind. That's loss, and then what comes from that is grieving. And we need to keep in mind that we grieve differently. And grief is very much about what we do with our loss, right? Some people call it psychic energy, but it's also what we need to do with our feelings and the emotions to actually experience and grieve appropriately. keeping in mind there's several kind of patterns of grief. There's the one which we think about as just being sad, but then you have intuitive grief, where we start actually creating things like organizations to talk about our grief, or organizations that's a way of managing this energy that I was so sad and I don't know what to do. And again, there is also the combined version of that, which is almost a blended version of the emotional kind of grieving and then the intuitive grieving. So you'll find there's a lot of literature written, especially when families go through loss and their grieving patterns. Not all the time, but a lot of the time men and women do grieve differently, and that can cause a lot of problems with understanding it. And I think that's maybe also worthwhile, understanding that our partners maybe won't grieve in the same way we will, and thus, or they expect us to behave differently, because we're all going through maybe a symbolic loss of what we thought life would look like. So that's just again what I was speaking about, just the grieving patterns. I can always share some literature on that with anyone who wants it, just to be also mindful of just where we're at. And cool, that's come out terribly, sorry, I apologize. But a lot of the time when we talk about grief, they give us Kubler-Ross's 4 stages. So that's fantastic to an extent, but I think it's far too simplistic. So if we look at what I prefer, there's the dual process model, is we're looking at an oscillation, right? Because unfortunately life carries on. Well, fortunately or unfortunately, I suppose it depends how we see it, right? But we can go through whatever loss we've gone through or going through, but then life continues. And sometimes I'm going to be very much focused in being loss orientated, and I'm focused to just restoration and having a normal good day. And then a moment I'm like, oh wait, hang on, this is actually upsetting me, and I go back to it. So we're going to oscillate the whole time. And it's about how do we build a life where not everything is fine, but we've also come to terms and we've processed our grief. And that's, like I say, it's going to, even sometimes years after, so it may be the diagnosis in this case, where life has been going really well and you've really managed it, and this is something you see on TV or you hear something and it really takes you to a point where you're like, wow, sure, that was a lot. And it might only be for a brief moment or two, but it's just something just to be aware of, that's normative, that's normal, and then we go back to our lives. So I think the last point I want to make is almost just a bit of self-compassion. And again, this is important because I think we have very easy it's very easy for us to be compassionate towards others, but being compassionate towards ourselves is so hard. So it's being mindful, there's being kind to ourselves. In the same way we'd give that room and that space to other people, it's about doing it to ourselves. And what is self-compassion? It's mindfulness. So self-compassion involves recognizing when I'm stressed or struggling without being judgmental or overreacting to it, right? It's a bad day. Everyone has a bad day. How am I going to survive the bad day? Self-kindness, being supportive and understanding towards ourselves when we are having a hard time, rather than being harshly self-critical. Okay, so it's not a great day. What is the minimum that I need to get through today versus all the stuff I want to get done? I think connectedness, remembering that everyone makes mistakes and experiences difficulties at times, and we're not alone. And that's, again, where reaching out to our social networks can become so important. So yeah, and that's from my side. I'd want to say thank you very much for having me. I'm always willing to share. If you want to reach out, drop me an email. I will try to answer you to the best of my abilities. And if, thank you again for having me. I think this is an amazing organization. And I think it's such an important aspect of just what is happening here today, is that we're seeing such an interdisciplinary aspect that's being highlighted. Thanks.